How is there a balance between maintaining hope and realistic discussions about the future of end-stage illness in children?
Well, hope is a big word and a very important one when you talk about palliative care patients or any patients, because as opposite as a lot of people think, palliative care is not a care that you can give only at the very progressive phases of the diseases. Palliative care is everything that is not curative care. If it's not something to cure the disease, if it's not treatment to cure the disease, so it is palliative care. Every human look, every human touch, every pain management care, everything that is not maintained to cure the disease is a palliative care. And so palliative care can be given since day one, even since birth, until they last. And hope, if we will really understand the meaning of palliative care like this, what we said now, so hope can be everything. Hope doesn't have to be equal to have hope to cure or hope to have longer life, because palliative care and hope is having quality of life. Hope can be celebrate my next birthday. Hope can be tasting the ice cream I like without vomiting or having symptoms. Hope can be having a visit of a family member that I miss a lot and I haven't seen for a long time. So if we will look at hope not as a one thing only, like getting cured, we can see hope in every step, almost in every minute in our patients' lives.
How can children be helped to cope with the psychosocial and emotional challenges associated with cancer and its treatment?
First of all, we need to acknowledge there is challenges, emotional, psychological, social, family-wise challenges we need to cope, we need to deal with. If we will see our patients only as a person with illness that we need to cure, we will miss a lot of aspects regarding his treatment, regarding the care that we can provide, because palliative care is low-tech. We don't need MRI machines. We don't need CT scans. We don't need the big amount of morphine or, I don't know. We don't need the equipment. We need to be able to look at our patients and their families, because when we talk about children specifically, we have to take under account their families. And so if you look at them as a whole, as a unit, a family unit that we need to help have quality of life, to deal with their challenges and crises in the family, only then we can give our patients the best medical care we can. Because psychology and family matters are something that we cannot take away. Because when one child of the family gets sick, it means one parent is absent from home, and the other one have to carry all the burden of taking care of the family and taking care of providing the family and managing the house chores. So the entire family dynamic is changing because of the sickness of the sick child, and we have to understand that. And if there are siblings, brothers and sisters, suddenly one parent is absent, their brother or sister is absent. Something is going on, and usually it's not talked about. Yes, I'm in adventure, yeah. You want water?
No, it's okay.
Do you want water? Okay.
Next question?
Yes, next question is okay.
Just if you want, you can end this.
No, I think we're good.
Okay. How do you support children's families in making decisions about palliative care and treatment?
This is a very important question, because you're asking about making decisions. And that's very important thing to understand, that in order to make good decisions for our patients, they have to be part of it. The days in which the doctors were the only one to have the information, the knowledge, and the power to get decisions are over. We have to include our patients in the part in which we are conducting discussions and asking questions and giving the parents opportunity to say their opinion. Because we may know better how to treat diseases, but they know better how to treat their child. And if we will not work together with the parents, we will not succeed. Because we're not treating only the disease, we're treating the patient. And the patient is the child and the illness that come with it. But we will not be able to give him treatment if we will not be able to reach out to gain trust. And a child will never trust a grown-up, a stranger, if his parents or his close family will not say, that's okay, you can do that. So we have to take the parents to be a partner with us. Medical staff and parents have to work together. When we're talking about children, we have to understand there is a triangle of communication: the medical staff, the parents, and the child. And in order to make very effective communication, we have to maintain a good connection, good relationship between all three parts, okay? So in order to have good communication and make good decisions, we have to talk, to communicate. The talking are not only the ones that are maintaining at the meeting room with all the staff or at the meeting mornings, you know, to speak about the patients. No, we have to talk to the patient and his parents, not only his parents. Kids know how to talk. They know better than us their bodies. If they're feeling their leg become numb, or their heart beating fast, or if they're feeling like the body became weak, they know better than us. We will never be able to get all the information regarding our patient and his situation if we will not talk and give them the opportunity to make decisions. Okay, it's not our decisions, it's our, as a group, as a triangle, okay, to make decisions, and it's very important.
Thank you. Do parents of a seriously ill child need to know in advance about the possibility of a palliative scenario?
Well, in my perception, palliative is not a scenario. Palliative care should be hand in hand with the curative care, just like we said before. Palliative can be given since day one, even if the disease is not stage 4. Even at the moment we give diagnosis, we can say, I'm here with you. How can we help? Do you have help at home? Do you need someone to support you? Do you have support at home? Do you have needs that needs to be treated right now? Maybe there's another sick child in the family and the parents cannot split and we want to help. Maybe we can put those two brothers at the same room. Maybe the parents are getting divorced right now and we can have social worker or therapist to help them go through this crisis. You know, we have a lot of things to offer, but if we will not ask them, we will never know. So palliative care is not a scenario that maybe will come. In my perception, palliative care should be there all along, since day one, okay? And that way, we will not need to prepare the parents for this kind of scenario. We don't want to be death angels, right? We don't want to be at the last step, the few last days of their child and say, hi, medicine, as we know, have nothing to offer to your child. I don't know how to help you, but I can offer you a hug or a support. That way, no one will want palliative care. But if from day one that we will meet the patient and his family, we say, we have bad news. Your son is sick. and we can offer you treatment, but we can also offer you support. And we can promise you that we will be here with you through this journey. That way, the parents will be happy to get support. They will not be afraid from the scenario of palliative care, okay?
That's really great opinion. In many parents, there's some misunderstanding about palliative care, and your answer was very...
You're right, because not long ago, the perception was that palliative care should be given only at the last days of life, only at the point in which curative care can not longer be given. But if we would change the perception and give palliative care since the beginning, together, hand in hand, with the curative care, so we will not be death angels, and we will be a support system. And that's a big difference.